Good morning and welcome to the Kickstart. It is a beautiful Monday morning. I'm sure everyone's excited for the week. Look forward to sharing some of the top stories with you. Time for our countdown, and then away we'll go. Hold on. All right, and welcome to the Kickstart, our weekly update of what's going on in the healthcare and health insurance industry. I also might give you a little bit of insights on what my thoughts are on different things that are going on as well. But we certainly appreciate you taking time out of your busy schedule to get started with us and kickstart off your week. A couple of things, real quick, to let you know about. If we do want to hear any comments or questions that you may have, so you can put those in the various chats that from whatever platform you're watching on. We are simulcast across LinkedIn, Instagram, YouTube, and Facebook. So, whichever of those platforms you would like to comment or ask questions from, please do so. All of it should be put together and sent over to us so that we can take care of any questions that you may have. Once again, sure appreciate you being here with us today. All right, we're going to jump right into this thing. Bad actors. Yep, bad actors out there. So we've heard a lot of the things that are going on a little bit now and then. We saw this last year. If you sell marketplace plans, that they put into place that you had to get a signed consent from your potential client even before they became your client. Well, here is some of the reasons why. There has been the uncovering of an ACA plan switching scheme. It shows that there are rogue agents out there. In fact, there's a number of organizations that were out there buying leads, as it were. What they were really doing is they were suckering people into coming into finding them online, and then they were changing their plan without their knowledge. So this lawsuit that was filed on April 19th, which was this past Friday, outlines a money-making scheme by which large insurance sales agency call centers bought names of people who responded to misleading ads touting free government subsidies. Well, we know what that is. That's a tax credit. And not only was it talking about subsidies, though, it also talked about other freebies that were just imaginary. So it really talked about other, some of the things we hear on Medicare Advantage plans, right? Buying groceries, dental and vision, all of these extra, paying for your rent, right? All of these extra things that really catch people's eye. Why? Because the primary target was low-income consumers. There's a reason for that as well, not just because, these are not smart people. That is absolutely not the case at all. There is many super smart people that may just have not have had an opportunity to make the income that they can make. But they qualify if you're at 150% or less of the federal poverty level. Easy for me to say. Federal poverty level, still easy for me to say. Then you qualify for a year-round special enrollment period. That means that anytime you want to start a plan, change a plan, you can do so. So they are perfect candidates for these bad actors to use that information to enroll them into a plan. Once again, sometimes these folks didn't know they were on a plan, or they didn't know they were being enrolled into a different plan. So they were switching policies without their knowledge. What's the problem with this? Well, there's lots of problems. Obviously, it's not legit, number one. But as for the actual consumer, that means they could have lost access to their doctor, to their medications, or some of the worst of all, they may not have the proper income listed there and have to pay back a substantial amount of those tax credits because they did not authorize this coverage. All of a sudden, terrible things can happen. Not a good deal. The folks that are filing this lawsuit are looking to make it a class action suit. This affected people in states all the way across the country. And the actual story that we'll send a link to you you can see some of the different folks that were affected. And they talked to even a lady from here in the state of Texas, and she talked about what her situation was. Her plan was changed completely without her knowledge. She had no idea what was going on. Bad situation, but once again, they're cracking down on this stuff for a reason. Now, what the worst part of it to me is it really makes all agents look bad, right? They got to lump us all in together. What they've had to do, of course, with all the different compliance things that they have on the Medicare side. I wouldn't be surprised if we start seeing more and more compliance things on the ACA side simply because of situations like this. So we'll certainly keep our finger on the pulse of this and see what's going on and keep you updated as time goes by, because obviously it's a really, really big deal. All right. We would be remiss if we didn't give you our weekly update on what's going on with the Change Healthcare breach. It seems like it's always something. But last week we talked about that once again, we're talking about bad actors here, right? The cyber criminal group Ransom Hub, that they were letting United Healthcare, letting Change Healthcare know that if they did not pay them, they were going to release data out onto the dark web. Well, it happened. So on Monday, Ransom Hub followed through on their threat, and they put some sensitive medical financial records stolen from Change Healthcare. They put that out there. So several personal information files were posted on the website. They included billing files, insurance records, medical information. Some of the files also actually included, interestingly enough, contracts and agreements between Change and its partners. That's interesting as well, because they're not really just saying, hey, it's the folks out there, but they're also sharing the data with some of their clients, right? Some of the folks that actually use Change. Where this will stop, man, who knows, right? This is obviously a big deal. It'll be interesting to see what comes up from this on top of what's happened, simply because now this is what we've been talking about for the last few weeks. Is this is the other shoe dropping. We saw the huge impact it had on the healthcare realm, and still is, as far as billing and access to care, prescription drugs, all the different things that it affected across the board on people getting access to care, physicians getting paid, hospital getting paid, doctors even being able to confirm benefits. But now the real problem, the real long-term problem, is going to be that data that was stolen by these bad actors, and what's going to happen with that data. What are they going to do with it, and who in turn is going to use it against all of the folks that had their data actually stolen? 4 terabytes worth of data is what the bad guys are saying they got. This was just a little sampling of what they have taken. Staying with this story for just a second, according to Change Healthcare, they have reinstated 80% of the functionality for their claims payment and pharmacy services. So that is a good thing. There's still a long ways to go, but that is where they are as far as the company has said, 80%, and they're still working on the other end. Should be back fairly soon. All right. So I touched on this last week, and I promised you I would dive into it a little bit more. I think it's very interesting. We look at the cost of medications in this country, and a lot of times the manufacturers are unapologetic about the fact that we pay more than anyone else. And the bottom line is they say, well, you can pay more, and we can charge you more, so we do charge you more. Someone's got to cover the cost of the R&D, and lucky you, United States, you get to do it. Well, this is really comes to light and is amazing to me how dramatic this is. So let's look at this study that was done by Yale University, King's College Hospital in London, and Doctors Without Borders. It points out that Ozempic, Wegovy, and other GLPs actually cost less than $5 to manufacture. So think about that. They sell for $1,000 or more a month, depending on the medication, and they can be manufactured for less than $5, which is generally, this is pretty cool. I don't know if it's cool or not, but this is an interesting fact. They can generally be produced for less than various forms of insulin. And we know that up until this point, insulin has been the primary, I guess you can say, treatment, right? The primary treatment for folks with diabetes. Now we've got some of these other things that have been coming in. Obviously, Ozempic's been around for a little while, but it's now that there's been numbers that show about the weight loss, it's become a lot more prevalent out there. And Mounjaro and there's other ones that fall into those GLPs, and they've become very popular over the last few years. But it is interesting to me that the manufacturing can be so much less. Researchers estimated that a month's supply of treatment could be manufactured from a range of 89 cents to $4.73. They actually took into consideration, which I thought this was interesting too, they took into consideration profitability. So at these rates for the manufacturer, they still put in some profitability for the actual manufacturer, and they still were able to make them for that low cost. But of course, the other side of that is the manufacturers come back and said, "Hey, we've spent billions upon billions of dollars in the R&D of these. We're still spending more on R&D of these to make them even better. These prices are justified." I don't know. I would have to say that I'm sure that they did spend a lot of money on that. There's no doubt that they spent billions and billions of dollars on doing the doing the R&D, and the manufacturing of them is there now. But at what time, at what cost now do we have to always meet that? It seems like the United States always picking up that bill. I think these type of studies that we see from well-respected researchers will make it more and more difficult over the long run for these companies to win this battle of we're justified in spending this much money or in charging you this much money. So we'll see where that goes. But it was a very interesting report. There, once again, in the we'll share those links with you if you want to go out and read more about it and actually read the report itself. But it's I think that's pretty interesting to me that they can really be created so much less. All right, and then our final story for today is about Medicaid unwinding. So when they did Medicaid unwinding here last year, there was concerns that people were going to lose coverage that weren't supposed to necessarily lose it because of the way that the states look at it, right? Not every state has a really good, well, as we found out, most states don't have a very good way of looking at this data. And it's not very accurate. Well, the numbers now show, and this is pretty concerning, is that 1 in 4 people that were dropped from Medicaid are still uninsured. So that means they've done nothing. Now, the study found that 23%, this was a KFF, so Kaiser Family Foundation study, found that 23% of Medicaid recipients disenrolled when states resumed their eligibility checks last year still don't have health insurance. Okay. Now, among the people who were removed from Medicaid during the unwinding, 47% said they eventually qualified again for Medicaid coverage. So almost half went back to Medicaid coverage, right? Great. Almost half went back to Medicaid coverage. A lot of times they were, once again, disenrolled simply because they didn't send something in soon enough or whatever, some kind of hang up with the paperwork. There's still a lot out there. About 30 million people are still in the redetermination phase of this. So we don't know exactly what's going to happen with them yet. But of the ones that did find something else other than Medicaid, more than 25% got their health insurance through an employer, through the military, or an ACA plan. And even some went on Medicare. Remember, you probably had some folks that were either Medicare, close to Medicare disability, and so maybe they qualified there, or maybe they had something else, depending on what the state was going on. They had some other reason that they would have qualified for Medicare, and they were able to eventually get on that. Overall, 20 million Medicaid recipients have been disenrolled since they started the eligibility checks. And then, as I said, there's another 30 million that are still being processed that it hasn't been determined whether they're going to get kicked out or whether they're going to be able to stay on. So it's still a big issue. And, we talked last week or the week before that they've actually extended the deadline for someone to get on an ACA plan if they were disenrolled from Medicaid. And that's actually going to go all the way through the end of November. So if you know someone that got kicked off Medicaid and they're still struggling to find some coverage, I'm not a huge fan of ACA plans. In some states, they're better than others. In Texas, ours are not too great. But at the same time, it's certainly better than having nothing, especially if something comes up that, all of a sudden you need that help. So I think it's very important that we keep in mind that there are situations that are happening with folks. We need to be sure that we, as agents, as brokers, that you lead folks towards the best direction. But you need to know that there's still a lot of people out there that do not have any type of coverage, and they may not realize that they qualify for anything. So if you have any questions about that, never hesitate to reach out, man. We're always here to help. All right. Do we have any questions or comments today? I am not seeing anything. All right, gang, give you guys a couple of minutes to ask any questions that you might have. And once again, tell you how much I appreciate you guys. Now, next week, we are going to have a recording of the show because during the time frame when we do this weekly, I will not be available next Monday because I will be en route to Benefits Pro. So if any of you guys or gals are out there and going to be in Denver for Benefits Pro, please look me up. I'd love to meet you in person. A lot of you, of course, I know already. I've had a wonderful time the last couple of weeks seeing folks and meeting folks out at NABIP, Texas, and of course the week before that at FMMA. But I know there's always a lot of my broker friends and a lot of folks that I haven't met, but I still have talked to here online and in particular on LinkedIn. Find me out at Benefits Pro. Love to have a conversation with you and see how I can help. And of course, hey, how you can help me too, because a lot of you guys are a whole lot smarter than me. So, all right, let's see here. Any comments? Doesn't look like we have any comments today. So we are going to go ahead and let you guys go. Appreciate everyone being here. Everyone have a super blessed week, and we'll catch you next time on the Kickstart.